Hello, so this is tobacco products and tobacco use. Tobacco has been widely used in North and South America for 8,000 years. First European explorers carried smoking back across the Atlantic. Met with strong skepticism and hostility, Germany and Russia imposed punishments on tobacco use. 15th century European physicians believed there must be some medicinal properties. In the 20th century, began serious examination of the long-term effects of its use. A very short history of tobacco use in the United States. It was cultivated in South America as early as 8,000 years ago. European colonies in the New World were largely fueled by demand for tobacco, but different types were preferred. It functioned as a currency in some American colonies. Civil War soldiers from both sides would call truce to barter for tobacco for other necessities. Tobacco crop yield rose, and machines increased the supply of cigarettes, leading to a price drop. Scope of the problem of tobacco use. Globally, cigarette smoking is a $400 billion a year industry. Approximately 800 million men and 200 million women around the world smoke daily. Almost 15 billion cigarettes sold each day. In the United States, smokers consume 387.6 million cigarettes annually. Just under 18% of the population now smokes, compared to almost 50% in 1950, though the true rates are difficult to know. The pharmacology of cigarette smoking. Primary method by which tobacco is used is smoking cigarettes, though chewing and cigar smoking is growing. Variables influencing the chemistry of tobacco. Exact composition of tobacco being smoked, how densely it is packed, length of the column of tobacco, characteristics of the filter being used, if any, the temperature at which the tobacco is smoked. Up to 40% of an average cigarette made of waste products, stems, dust, scrapes, etc. Nicotine. Isolated in 1828, the effect on nervous system identified in 1889. With each puff, a small dose of nicotine enters the circulation that reaches the brain within seconds. A one-pack-a-day habit results in about 85,000 puffs per year, which leads to saturation of one of the acetylcholine receptors. Reduction of ACH saturation takes about 45 minutes, which can lead to an all-day behavioral cycle. The effects of nicotine on the body. Quiet nicotine. Lethal dose of nicotine for an average adult is 40 to 60 milligrams. Oral administration subject to first-pass metabolism. Nicotine addiction. Activates the nucleus accumbens, part of the brain's reward system. Neurochemical changes in the brain after a few cigarettes suggest the addictive quality. 33 to 50% of those who experiment with nicotine become addicted. Nicotine addiction. Minimum of 66% of smokers are addicted and demonstrate the following symptoms: tolerance, characteristics of withdrawal symptom, and drug-seeking behavior. Regular users titrate their smoking to maintain a fairly constant level of nicotine in their blood. Cigarettes with higher nicotine result in less smoking to balance blood levels. Nicotine withdrawal symptoms begin in 2 hours, peak in 1 day, and decline over the next 10 days. 1/4 of smokers report no significant withdrawal. Sleep problems, irritability, impatience, difficulties in concentration, lightheadedness, restlessness, fatigue or drowsiness, cravings, hunger, GI upset, and/or constipation, headache, and increased coughing. Extended withdrawal symptoms may continue for 6 months, though intensity may vary between individuals. Complications of long-term use of tobacco products. Body of cigarette smokers appears 5 to 10 years older than chronological age. Average U.S. male smoker loses 13.2 years of his life, 14.5 years for female smokers. Approximately 7 million deaths worldwide per year, including 15,000 non-smokers through passive or secondhand smoke. Causes: 17 to 30% of cardiovascular deaths, 24% of pneumonia, influenza deaths, and 10% of infant deaths yearly. Portions of cancer causes associated with smoking. So lung cancer, 87%, esophageal cancer, 75%, bladder cancer, 30 to 50%, and pancreatic cancer, 30%. Complications of long-term use, 3 or 4. The mouth, throat, and pulmonary systems 10 to 15 times more likely to develop lung cancer compared to non-smokers. I think that's supposed to be lung, not long. 27 times more likely to develop laryngeal cancer, increased chance for bronchitis, pneumonia, and COPD. Only 1/3 of those tested were aware that they had COPD, which is found in 20% of smokers. The digestive system. Cause of half of gum disease and tooth loss, related to GI ulcers and stomach cancer. Cardiovascular system, related to 30% of heart disease deaths, increased risk for hypertension, premature aging of skin, releases chemicals that damage neurons in the brain. The reproductive system affects both men and women, including erectile problems and other complications. Smokeless tobacco. Multiple types of smokeless tobacco, 3.5 of users. So mostly snuff, dry snuff, chewing tobacco, snus, and dissolvable tobacco. Some established smokers try to quit smoking. Increased risk of oral cancers, predominantly male, often start in teen years. Secondhand smoke. Exposed to many of the same toxins as smokers, a majority of non-smokers demonstrated contain a metabolite of nicotine in their blood. Increased risk for developing pulmonary disorders such as lung cancer and tuberculosis. Can put adults at risk for cognitive impairment. Researchers believe that secondhand smoke causes approximately 6,100 deaths in children each year in the United States. Smoking cessation is one of 2. Nicotine is among the most addictive substances in the world. Only 4 to 7% can quit without assistance. Between 70 and 80% will relapse in the first 6 months, and typically take 5 to 10 serious attempts to quit prior to success. More than 80% of smokers have tried to quit at least once, and around 30% eventually quit. Cold turkey is the most common but least effective method, and relapse triggers are a factor in more than half the cases where the former smoker relapses. There is a poorly understood relationship between depression and cigarette smoking, but for many, smoking becomes a coping mechanism for negative emotions. Cigarette cessation and weight gain. About 80% of smokers will gain weight in the early stages. Those attempting to quit, on average, take in 200 more calories per day. An absence of nicotine can decrease metabolism. Some weight gain is preferable to continuing to smoke. Weight gain when quitting smoking. So time since quitting 1 month, your average is about 2.46, 12 months. So it just goes on like that. So by 12 months, weight gain is about 10.27 pounds. So tobacco use in the DSM, tobacco use disorder, tobacco withdrawal, other tobacco-induced disorder, unspecified tobacco-related disorder. So that's it for this video.